and health and how we should know about it. Mheshimiwa, welcome to the program. Karibu.
Thank you very much.
First of all, are you vaccinated?
Due to patient privacy, I'll skip the question.
No, you just have to tell us. We start from okay, the oath of secrecy.
Yes.
Okay. So it's all over, and we know a lot has been happening in the country. You know, the COVID is here, and politics also here. How are we contending from the professional side of view?
You know, the problem we have in this country is that
yes.
The professionals, in terms of stakeholders, are basically left out of all the plans that are put in place by the government.
Yes.
The government still believes on this thing of top-bottom approach on all the issues. And that's why you see now we have a different narrative where we are saying bottom-up approach in terms of addressing issues affecting Kenyans. And even as I sit here today, I'm a key person in terms of healthcare system in this country, but I do not know the measure that the government has put in place. For example, when it has said now from yesterday, our public transport system will now have to carry passengers to capacity. If you asked me what measures has the government put in place, I'll not be able to tell you. So we go in outside your houses and you pump into decisions made by the government, not knowing what the government has done that is so unique when you have Delta variant today ravaging the country, and we are actually doing so badly today. I can confidently tell you that the numbers that were being given by the Minister of Health are not the true picture of what's happening in the country.
Really?
Because our testing ability in Kenya is crippled. We are not able to test everybody that we come across. For example, what is the policy on testing? They only test people who go to hospital. The issue of even tracing ended long time ago. So when we are told that the rate of infection is 15% today, I still doubt those figures because we don't have a testing policy in Kenya where you are told that for us to know the prevalence of this infection in this country, we need maybe to go to a place and pick people randomly and test them. That's not happening. They are testing people who go to hospital, then they give us those numbers. So we have that problem in the country. Those who hold the wings of the government and who decides what happens to not matter what stakeholders have to say or even the common mwananchi. So we sit and wait for them to make decisions.
You are not consulted because now Matatu resumed full capacity yesterday.
We're not consulted. Who will consult us in the first place? We have a ministry that has never made this union. We have a CS that has never made this union. Even when we write letters that we want to have a meeting with you, even just a courtesy call meeting, Kakwe will not allow. And so we have a CS that I don't know whether he does not understand the meaning and the role that nurses play in this country or not. So we've reached a place where we are saying, now let us look at what affects us as workers. As long as we can be able to fight, because we are not living in this country, we are barely surviving. I'm saying we are barely surviving because how will I continue to fight and say that before we open up the country to have full matatus in place, have this in place, when we ourselves, we are not accessing healthcare services. We don't have comprehensive medical schemes, and where they exist, for example, money is not remitted to NHIF, so that when you go to with the NHIF card to a hospital, you are turned back. You are told the NHIF does not pay. We are not going to allow you. You can't be treated on NHIF. So you have to go down your pocket, sell your cows, sell your land, and then you go for treatment. And yet you are a public servant whose money was taken from the payslip, which was called medical allowance, to come up with comprehensive medical insurance for public servants. So we have serious problems in this country in terms of involving of stakeholders and the public.
You've raised a very worrying point there, that the kind of information that is there is not the real reflection of what the government is telling people.
No, it's not. It's not. It's not. This Delta variant thing is really causing havoc in this country. People are dying. People are dying in the village.
What is the situation like?
It's so bad. Like where I come from, people are dying every day. And when you ask, what has killed this person? They say, we don't know, he just died. Later on, when they take samples, we hear it was COVID-19. So those who are dying and they're not going to hospital for post-mortem, and you know, most of people in the village, you die like today, and they say, the government is saying, we bury you tomorrow, pereka kwa moshari hapa, makama ni wapi karibu, after 2-3 days, they do the harambe, and then they bury you. So it is not really giving us the true picture, but that may not even be be what is of great importance for us. Knowing the numbers, the exact numbers may not be important. What's important is the action, for example, that has been taken, that now vaccination has been opened up to all Kenyans, so that they can be vaccinated. I think that's a step in the right direction.
Yes.
All Kenyans have the right to be protected against any ailment, because even if you protect those health workers in hospitals and you're not protecting the larger population, you're doing nothing. So that's a step in the right direction, and we need more centers of vaccination to be opened up. But you see, the problem we have in this country is that investment priorities are skewed. They do not know where to put their money. Why will you put billions of shillings, for example, on a useless project like BBI, instead of taking that billion and buying vaccines enough to vaccinate all Kenyans? Today we should be talking about the government has put in place the measures to ensure that every Kenyan will be vaccinated. This amount of money has been set aside. But when it comes to priorities, it is skewed, because maybe when you buy a vaccine, there's no kickback from there. So they want to do projects where there's kickbacks. We need serious government officials who are really going to take care of the interests of the Kenyans and not looking at their personal interests.
The question is, do we have enough vaccines in the country?
Of course, we don't have enough vaccines in the country. We do not have. And even the few that were in the country had a lot of mischief, information that was misleading, and many people do not want to take the vaccines. For example, up to now, we have not been clearly told if you are infected. Do you have herd immunity, or do you need another vaccination? From where I sit, I believe if you are infected, you don't need to be vaccinated. But these are things which have not been covered. Because what's that vaccine? What you call attenuated infection. It's an infection, a real infection, but it has been reduced to the levels that it cannot cause full-blown infection when you are inoculated with it. So when you are inoculated with that vaccine, it triggers the system to produce antibodies that will fight against that infection when you get it. So if you got a full-blown infection like myself, do you still need a vaccination? Those are the questions that have not been answered up to today. And we see many of the health workers who have been infected and they know how the immune system functions. They are reluctant to take those the vaccination. Very much reluctant.
Have you initiated a conversation surrounding all these issues that are trying to raise?
Where is the platform?
But you can get a platform.
We are talking with you here. This is the only platform I have to engage government if somebody within government is somewhere listening. But the government has not found it necessary to engage us.
Mheshimiwa, I'm so sure you can reach the CES just directly.
No, the ministry is out of bounds for nurses. It's not, a ministry is not open for nurses. We don't have stake in that Ministry of Health. In fact, what is there today is that we are now completely, there is a clandestine operation by the cartels, the ministry, to remove the Department of Nursing Services from the Health Act. So are being kicked out of the ministry completely.
Why?
They have dismantled the nursing department.
Why?
You see, nursing department, nurses happens to be maybe, I'm sorry to say that, but I'm a nurse. I'm not being prejudiced to any other profession. But I'm saying we looked at people who don't know how to steal. And if you don't know how to steal, you are not needed where stealing takes place. And that's why they're dismantling the nursing department from Afya House. We are nowhere completely. There is no any healthcare system that has succeeded in the world where a nurse does not sit on the table of policy making. When you go to America, for example, one of the best healthcare systems in the world, America runs the best armed forces health system in the world. Who is the Surgeon General? Because that's now like the Director General. It's a nurse. When the former president for United States came in power, the famous one, he appointed a Surgeon General.
Are you talking about Barack Obama?
No.
Clinton?
The one who has just left office for Biden to come in. No, the one Biden took off from Trump. Trump appointed a nurse as a Surgeon General. So the head of the healthcare system in America today is a nurse. I developed a first-class, a superpower country like that one, taking a nurse and putting him at the helm of the healthcare system in Kenya. And we have a third world country like this. You have some fool sitting in Afya House trying to remove the entire profession from Afya House. Then you can see where we're headed to. All the problems we have in Kenya in the healthcare system go for those who are managing healthcare system. It's not nurses. Those managers are the ones who have given us all these problems. They are the ones who have surrounded the minister. They don't want Panyako to take the ministry because they know Panyako is a straight-talking person. He does not fear anything. And he will tell the ministry and whoever dares to hear the truth on what should happen. That is why you hear, whenever, I have always said this thing before, that when you hear the numbers on corruption in Kenya being listed in Kenya by EACC, you will hear that the most corrupt department is the police. The second one is health.
Yeah.
If health is not number 2, it's number 1. But have you ever seen anyone being prosecuted in the Ministry of Health for corruption? What happens in the Ministry of Health is a royal haste, where the royal, those who hold the wings of the power in this country, are the ones stealing from the dying Kenyans. It is so bad when you go to a hospital, there's no medicine. Like you are supposed to go to theater, there's no anesthetic machine, it's not functioning, there is no nurse, there's no anesthetist, and if the personnel is there, there is no medicine to take you to theater, and a mother dies waiting to go to theater, or loses a baby waiting to go to theater. When you ask these people, a mother has died waiting to go to theater, they ask, why did she not go to theater? Because for themselves, they have never gone to those public hospitals. They go to Nairobi Hospital. Yeah. If things go bad, they run to South Africa, they go to USA, Britain. But the common manager down there who need these services, who's not able to access this private clinic, leave alone hospitals, private clinics in the village cannot access what is available.
That reminds me of a medic who allegedly committed suicide because of the, the suicide note said that she regretted of the working condition she had. You remember the lady who committed suicide?
Yeah, I remember very well. It was in Central.
Okay. Where do we see ourselves as a nation? Because right now, as it is, elections are here. Campaigns are going to go full-blown. And as a member of parliament, every politician is going to hit the ground running. No more, the number is projected to be 10 million by end of December. But you expect Kenyans to go out there and start campaigning. What are you seeing? Are you seeing that dark moment for this country in the next 1 year or so?
I have never wanted to be a prophet of doom. By the way things stand, the truth is that if I were charged with the responsibility of making decisions, I will ensure that before elections, at least 80% of Kenyans are vaccinated.
Where are we right now in terms of percentage?
We are nowhere. I saw the 4 point something percent. We have vaccinated about 1 million Kenyans, 1.6 million, out of around 50 million. That's a very small percentage. So that will be my focus as an administrator in this country. And if I go by the lines I saw when now it went to the public, and the public are willing to take this vaccination, I will now invest in bringing in the vaccines and ensure that we vaccinate, we go into mass vaccination. We even go to homes. We even said this thing in the estates and people get vaccinated.
Like polio, they will usually do it.
Like even I'll put a law and say no one will be allowed now after, like if we have enough vaccines, because you can't also put restrictions on people when you don't have enough vaccines. But if we had enough vaccines, I'll tell you, from January, you will not be allowed to enter a supermarket in the country if you don't have a vaccination card. But how do you come up with that kind of regulation when you do not have enough vaccines? You see?
Yeah.
You must have fast enough vaccines, because if you say like that, I can assure you the vaccines which are in the country today will be finished in 1 day. And there will be more vaccines. So the country is lethargic, as somebody says, that they are waiting for free donation. Here we are a country that we are suffering, we are dying, and yet our leaders are sitting down there, keeping money for campaigns and BBI, waiting for us to be given free donations.
But somebody would argue that the supply chain is squeezed. That's why we don't have enough vaccine in the country. Many countries depend from the suppliers.
No, if many countries depend for suppliers, South Africa is now manufacturing their own vaccines. Kenya was a key proponent in terms of in the research on AstraZeneca.
Yeah.
Why have we not brought the production of AstraZeneca in Kenya? We are busy politicking. We are busy fighting people, chasing each other on politics. We have, as I said earlier, we have skewed priorities. We don't know what the country needs, and that's why we are saying we in the UDA we want top approach.
Yeah.
We want that Mwananchi on the ground. We want that Wanjala, that Wafula, that Bahati in Mombasa or wherever you are, to suggest something to the government that this is what I want to see happen in this village. And at least 1 or 2 villagers can say after the budget has been read that actually our suggestions are being implemented. We don't want a situation where things are trickled down. You are up here and you decide what to do on the people on the ground. Let the people be part of the economic planning.
Yeah.
So they are able to evaluate. They say we wanted this has been brought. Has it been implemented? So today if you ask Kenyans, many of them will tell you we want to be vaccinated. But where are those vaccines? Where are they? If you say that the supply is not okay, where are our priorities? By the time Kenya was participating in research on AstraZeneca, it should have put measures in place to have our own production here. I heard that somebody called Aidin was putting up a manufacturing plant for vaccines in Uganda, and he was deported at night in this country. They deported Miguna. This country is, you see, if it is true that this man was going to put up a vaccine factory in a company in Uganda to produce vaccines, what I would have done if the person in power is to get in touch with the Ugandan government and find out if that is true. And if it's not true, let this person face the full force of law. So the problem we have in this country is politics. Politics. Everything is politicized. They don't care what happens to the Kenyan people. Like today as we are talking, IFMIS was blocked on 15th of June. Just before the president went to Europe. And up to now, it has not been opened. County governments barely have no money to function. So when you say that you devolved services to the people, I saw Honorable Boss Sholei saying that devolution was meant services to the people. That is what it's supposed to have been. But now, are people getting services when you block a system of transferring funds to the county government for more than 1 month? Definitely, they are not getting the funds. Today, how are counties paying salaries? Counties have made arrangements with the banks. They get money from the banks, and then they pay net salary. Third-party deductions are not going. And today, as we are sitting, health workers, public servants across the county governments are now crying. They want to go on strike, not because they want salary increment, but because they want what has been deducted from their salary to go where it's supposed to go. You can imagine how painful it is. You have a premium. Because some health workers have decided, some public servants have decided to go a long way in securing themselves, even health. You have a premium where you are taking care of your family. For example, you have a large family that is maybe not covered by maybe the government health policy, like insurance. Then you have a private premium with a private company. You are deducted money to go to that company. It doesn't go. When your family goes with a card to a hospital to be treated, you are told this card is empty. There's no money. Money has not been given. When you go with the NHIF card today for treatment in the hospital, you are turned back. You are told, no, NHIF is not giving us money. But
the people were supposed to take some of these legislations to the floor of the House so that, you know, the country cannot make some arbitrary decisions unless it's ratified by Parliament.
Unfortunately, I've told you that this country is not, everything is not right in this country. It's true, I was elected as senator for Kakamega, but I don't sit in the Senate. I'm the one who was elected by the people. When you hear people talking in Kakamega, they speak so bitterly. All 12 sub-counties, no one beat me. But do I sit in the Senate? One of the visions I had as a health worker was to work on a health act, to amend the health act. At that time, there was no health act. Is to work on a health act that will provide free and compulsory healthcare services to all Kenyans. Basic. Basic. Free. If you walk in any hospital, you must get that healthcare service. 2 is to find out how this healthcare service was going to be funded. One of the ways was through NHIF. Another, for example, look at the corruption in healthcare system. Look at a private hospital. It charges a bed just the way a public hospital charges. Like when you go to Aga Khan, the charge on the bed is the same like the one for Kenyatta. But you see, when you go, for example, to Kenyatta, you'll find out that workers are paid by the government. But when you go to Nairobi Hospital, they are paid by the hospital. So when you try to look at these things, you try to find out, now, this money being made by the public hospitals through cost sharing. Oh, they will tell you we buy medicine, we do what. But there is a lot of money being generated there, which is not, some of it will be recouped into hiring even more health workers. That's not happening. So this country, I'm very disturbed. Very disturbed. Kenyans are not getting services. In fact, I was just saying yesterday, if the president has blocked IFMIS system because the government is broke, let him come and tell Kenyans that the government is broke, we do not have money, we must reopen a discussion on whether devolution has worked or not. If it has worked, where has it succeeded? Where has it failed? What can we do with the failures? So that you don't devolve 85% of Kenyan workers, take them to the county governments, and they go and suffer. For example, we used to have mortgage. where you will pay 3% interest on the loan you are given to build a house and to do anything, or a loan to buy a car. You pay 3% interest through government. All county public servants do not have access to those facilities. Why? There is no even money to pay salary alone. How will the county government put aside money for mortgage and car loan? So county public servants are suffering in the hands of a rogue government.
Yeah.
National government, things are running as usual. Everything is running. So you wonder, why do we have a national government running so smoothly, and they have crippled operation of the county governments, which 99% of the healthcare system in Kenya has been devolved?
Mheshimiwa, let me just ask you one question. Give me maybe 2 or 3 things, good things that this government has done in the health sector.
I'm so disappointed with this government.
Just 2 or 3.
One of the things they did which was good,
right,
though it was done also again top bottom trickle down system, was the issue of trying to equip hospitals, 2 hospitals in each county to the level of a referral standard. Now it has not succeeded in 80% of the counties. Why? Because it was not bottom-up approach, where the national government went on the ground, talked with the governors, the National Assembly, and public participation, and then they agreed. For example, in Kakamega, where I come from, in Malava, these are the equipment we want. In Kakamega PGH, these are the equipment we want. Then they tell the national government, according to the capacity we have, these are the equipment we can manage, and we can have them deliver services to our people. But this is what we want to offer. We will want this equipment, but this equipment must be followed by the personnel or the infrastructure. Like when you go to Malava, where I come from, because I come from Malava constituents, you find that those equipment, that managed medical equipment, were taken to Malava, and because there was no even a room where they could be put to operate, they were locked somewhere. They are rusting there up to now, and yet Kakamega County is paying 200 million every year to service those equipment. So that was a step in the right direction, but it was not done properly. It was again trickled down by the national government, because they are also eating from, because how can I be paying 200 million on something that we can buy for less than that amount of money? I don't know for how long we are going to spend that money paying these people. So that is one of the things that the national government did that was good. There are so many things that the county governments have done in terms of expansion of infrastructure. They are building hospitals, they are bringing up facilities, but the problem is those hospitals they are building and health centers, they do not have personnel. They do not have equipment. Here in Nairobi, I'll give you an example. You saw the president open up various facilities across the county, which is a very good thing. I applaud the president for that, because people in the slums have suffered for a long time. You have to come from the slum at night, there's no vehicle, you have to go to Kenyatta. Now you have services closer to you. But now, services are not being offered in those hospitals. For example, I'm aware a chief officer was forcing doctors to operate in a hospital that does not have even a lamp, operation lamp. There's no operation lamp in theater, and someone tell you, go and operate. How will you operate on that patient? So we need to when we come up with project, when government comes up with a project, first of all, they must know that this is public funds. Whether they are borrowing that money or not, we Kenyans are charged with the responsibility of paying that money. So let us actively participate on how our money is being used in this country. But the way things are today is somebody sits somewhere, makes a decision, I want to borrow this amount of money.
All right. So have you raised some of these issues in Parliament?
I'm not a member of Parliament.
Probably through the organization.
I'm not a member. By the time that doctor was committing suicide, we had been in Parliament and the Senate so many times. In fact, the Senate sat and produced a report that health is not better at the county governments. They require to have the health service commission. But no one has taken any step through legislative action to ensure that the Health Service Commission is fruitful. When they go to BBI, they talk about a statutory body. A statutory body cannot be used to amend the Constitution. So these issues requires leadership that is honest. The Senate is using the woos in the health sector to fight the governors, because most of them want to go and to become governors. But if they were serious that they want to address these issues that Wananchi have given them, because by the time the Senate was coming up with that report, they must have heard from stakeholders and Wananchi. And the report is excellent. But where is the implementation? BBI is here. We had Health Service Commission in the first BBI.
Yeah.
The second BBI, it was not there. When you ask how it was removed, no one tells you. No one opposed Health Service Commission, and yet it was removed. People sat somewhere and said, look here, if we remove the Health Service Commission, if we allow it to go through, wananchi will vote for it. But this country does not belong to politicians. Let the Kenyan people decide whether they want the Health Service Commission or not.
Yeah.
Why are they scared? They are scared because they know that health at the county government level is very unpopular. Wananchi ukiwauliza wanasema, let us return the health sector to the national government, because that's what the wananchi know.
Yeah.
But with the profession, we are saying we want an independent commission to manage the health, human resource aspect of healthcare system in this country.
Yeah.
Look at it. Only public servants in the counties, including health workers, have not been paid salary. And they are not accessing any other, because the third-party deductions have not been affected. July salary has not been paid to all the counties, apart from those that have met arrangements. Now the question is, why is it that we don't have a problem with the police? They get their salary on time. The army, the judiciary, the national government in general.
Yeah.
Why is it that there is no problem with them getting salary on time? Why is it that their old system that was in place in terms of mortgage is still intact? Why is it that these things have been dismantled at the counties, and earning a salary at the county government level, it is like when you hear that Jesus has spoken to you. It's like umesikia Mungu ameshuka. It is terrible. It's horrible.
Right.
Life at the county government is miserable. And unless something is going to happen, I can tell you for free, this country is preparing for a revolution. And the revolution is, we must take this country back to the people.
Back to the people.
Yes.
Election is just 1 year away, and we are likely to see politicians crisscrossing this nation. Something that is perhaps giving you some hope that tomorrow is going to be a better day. Do we have some hope as a nation from the clinical perspective?
Professional, in terms of clinical perspective, as you have said, and not political aspect.
Yeah. Yes.
Is that the hope can only be there if I see practical steps being taken by the government to ensure that every Kenyan is vaccinated before the campaigns begin. If that is not happening, and I'm not seeing it happening now, even if they opened the vaccination yesterday, within 5 days the vaccines will be out of stock. So I have not seen something very, very positive. But the only thing that I'm happy about is that Kenyans have always survived. We have always survived through storms. And I know this COVID-19 is just one of them. And I know we shall walk over them, we shall go through those elections, and we shall survive as a nation.
Yeah.
I have a belief in the Kenyan people. I am a Kenyan, and I believe that we are able to survive. We shall survive. But we must, as Kenyans, open up our eyes. Let us see beyond our tribal cocoons and know that what affects a Kalenjin affects a Kikuyu, affects somebody in Mombasa. Today, the prices of all essential commodities have gone up.
For everyone.
Everyone. But when elections come, you hear some fools start talking about Domi Kikuyu, mutu wa nyumba, siju mutu wa nyumba, unasikia mtu sema mutu wetu. Huyu mutu wenyu akishaingia ka State House, anakula peke yake huko. Nyinyi na wananchi wa kawaida, you continue borrowing salt from each other. Jioni mnaombana chumvi. Lakini there is no day you'll ever go and uombe chumvi kwa jirani yako kama na wakubwa.
Yeah.
Manyumba zao wesi ingia. So what I will tell Kenyans today is that it is a time we embraced ourselves. Let us not embrace the leaders.
Yeah.
And these leaders, you know who they are, the culprits. They must be sons of so and so. But you, the common man like Panyako, the son of a jackal seller, you have no stake in this country.
Yes.
That's why we're saying in 2022, we must take over this country to the common mwananchi, popularly known as the hustler nation.
Okay. My last question is, are the nurses vaccinated, the frontline workers? The government said that part of the vaccination drive was supposed to start the frontline workers, among them the nurses and the medics.
The uptake was not that what was expected. Right. As I've already explained to you, there were a lot of mysteries and stories coming up with that vaccination. But a good number of nurses and other health workers have been vaccinated. Mine is to encourage them to be vaccinated because they are the frontline health workers. Nurses spend more hours than any other health workers with the patient. In fact, we have the patient 24 7.
Yeah.
And when you look at the risk of getting nosocomial infections or COVID-19, we are 30 times more than any other health worker. So it's extremely important that nurses get vaccinated, and as well as all other health workers get vaccinated, because if we vaccinate nurses alone and don't vaccinate others, we work as a unit. A nurse cannot work without a doctor, without a lab person, without a cleaner, you know. These people who clean hospitals are extremely important. They are called today health services assistant. They have now a new approved name. So everybody in the hospital moving forward will be trained. Even the cleaner will be trained. Very Not like you pick somebody from class 8 or the village on the road, and then you bring. So everybody will know what you're supposed to do in the hospital. Whether you're a cleaner, a watchman, or what, you will be trained. You have some kind of training. All right,
Mheshimiwa, we are coming to an end, but this is your camera. 2022 is coming across here. Where are we likely to see you? Are we likely to vote for you again?
The truth is that first I want to thank the people of Kakamega for the trust they had in me in voting for me as their senator. What happened is the water under the bridge. In 2022, I can assure them that I'll be on the ballot. The only thing that I cannot assure them is I'll be on the ballot on what post, because the people of Malava have insisted that they want to see their son serve them first before he goes to serve other people outside there. So I'll be having a meeting in my home on 15th next month, where I'll be meeting the people of Malava and the county representative to decide on what seat I'm going to go for.
You see,
thank you very much.
The good thing about politicians, they say that I consulted my people. My people told me that I should go. All right, thank you, Mheshimiwa. Thank you so much. We'll be talking to Seth Panyako, who is a representative of the Nurses Union here in Kenya. And of course, just talking about issues to do with health. He said, if you've not been vaccinated, if you can get access to that vaccine, go out there and get vaccinated. All right. I hope this is the best place to come to a close to this particular show. Mheshimiwa, thank you so much for coming.
Thank you.
And we hope for the best. And even you as a Kenyan, please do that due diligence and be a good person. If today was not a good day for you, don't lose hope. Tomorrow is going to be a better one. My name is Victor Oloo on behalf of my co-host and the entire crew. Have a good morning. Bye-bye.
Thank you.